Hello and welcome to a special episode on the Dettol NDTV Banega Swasth India campaign from Aragonda, a village in Chittoor district of Andhra Pradesh. A mission that was started in 2013 to bring international standards of healthcare within the reach of every individual, the Total Health Program. The man behind this vision was Padma Vibhushan Dr. Pratap Reddy. Aragonda gets its name from the Ardgiri temple. Ardgiri means half mountain. It is believed that when Lord Hanuman was carrying the Sanjeevani, a portion of it fell here. The objective was to create a healthy and happy living environment through prevention and management of diseases. While delivering the healthcare services at Apollo hospitals, the Total Health Initiative focuses on disease related to inadequate water, sanitation and hygiene. Dr. Pratap Reddy's Apollo hospitals cater to people across the country. Hence, meeting the healthcare needs of his native village was what led to the Total Health Initiative.
The real concept of total health is that health is not static, it's very dynamic, and it's an interplay of a lot many things. Whether it's your genetic makeup, it's your physical surroundings, the environment, the spiritual aspect, the economical aspect, and all these things allow your genetic makeup to actually play its role in disease and in health. So that is the concept which we had when we conceptualized this Total Health Program for this particular Thavanampalli Mandal. And Thavanampalli Mandal we chose because it was the chairman's birthplace, so that's why we selected this area. And we chose to have a very holistic view, not only health, but we looked at water supply, we looked at skills, we looked at yoga, lifestyle modifications, sports, even agricultural. So all these things we brought together to give a concept of a holistic health.
Before 2013, health statistics were poor in the area. Total Health has been delivering preventive and primary healthcare services across villages in and around Aragonda, Thavanampalle Mandal of Chittoor district of Andhra Pradesh since 2013 onwards. From nutrition centers getting supplementary nutritious food, along with healthcare services and institutional deliveries to total well-being and school hygiene curriculum.
पहले तो हेल्थ के बारे में उनको कुछ ज़्यादा मालूम नहीं मैडम। हेल्थ केयर बोले तो हॉस्पिटल जाना है, वो प्रेगनेंसी को बीपी है क्या, बीपी ज़्यादा हो या क्या, कंट्रोल है क्या, चेकअप करते हैं, टेस्ट करके पूरा वजह से चेकअप करके फिर डिलीवरी का दे होता है ना, इसलिए तल्ली माता शिशु संरक्षण अच्छा होता है माता शिशु का बोल के उनको बहुत पसंद आता है। आगे न्यूट्रिशन सेंटर में फूड भी खाते हैं, टाइम से भी बच्चों को लेकर फ्रेश अप करके भाग लेकर आ जाते हैं।
The 11 nutrition centers have supported nearly 400 anemic mothers so far. Mission of Total Health is focusing on nutrition, hygienic nutritious supplements like a glass of milk, an egg, dates and a peanut jaggery candy 6 days a week to expectant and lactating mothers for a total of 27 months from conception.
We started with nutrition centers in level centers. Before starting, we just came for health camp. We just conducted health camps. During health camps, so many pregnant women and lactating mothers are facing their HB levels are low. So we started screening them, and we started definitely we need the nutrition center here. They are happy taking this food. Along with this, we are Arogya Rakshak project new program. So we thought about breast hygiene while breastfeeding. They have to do hand washing and they have to give breastfeeding. Weekly once they will have a health checkup.
Chukama's hemoglobin was a case of mild anemia. With regular visits to the nutrition center, health checkups and better diet, she gave birth to twins and they both were healthy.
Pregnancy ఉన్నప్పటి నుంచి వస్తానమ్మ ఇక్కడికి బాగానే ఉంది తింటానమ్మ తిన్నాక బాగుంది బ్లడ్ అయితే తక్కువ ఉంది మేము వచ్చినప్పుడు ఇప్పుడు కరెక్ట్గా ఉంది అప్పటి నుంచి బాగానే ఉంది బాగా తింటా ఉన్నాము ఇక్కడికి వచ్చినాక హ్యాపీగా
To make primary healthcare more accessible, regular checkups to mobile medical clinics, satellite clinics, weekly clinics and general health screening in schools and Anganwadis have helped in spreading awareness.
We have a schedule of around 15 to 16 villages, and we'll visit it within 15 days once. And we have more patients of diabetic and hypertensive patients, and the old age patients are they are very convenient to come here because they can't go to faraway places for these checkups of BP or sugar checkups. They can't go. It is very convenient, and if they are lazy or they have any work, they can't go to faraway places.
While the first 1,000 days of birth are important, old age is a sensitive phase. Elderly people need care and comfort to lead a healthy life without worries. As part of the Total Health Program, geriatric nutrition centers that provide healthy meals and regular healthcare services are a unique effort seen on ground. Shaikira and Damodra are a few amongst the elderly population of Aragonda who are enjoying the facilities at these centers.
मैं आती हूँ 6 महीने से आती हूँ हेल्थ चेक करते हैं मात्रे देते हैं ये चाय बिस्किट देते हैं ये कवर पैक करते हैं पैसे देते हैं महीने को धर्मक सका
We are coming daily from 10 to 12. We are staying here and passing time. And here the convenience are newspaper, TV, carom, chess, like that some activities. And they are giving tea, otherwise buttermilk, some sundal, like that at the time. And we are happily passing time here 2 hours, then we are going.
Geriatric population is becoming a reality. As you know, we've touched NRR of almost 2.1 rather, and that means it's a replacement population. You know, we are still a young population because we have got that population momentum, but another 10 years you're going to see a situation where the number of people in the elderly age group are going to increase phenomenally, and India cannot be just wish it away. It's going to be a reality in India also, and these are the people with the nuclear families who are not looked after, who feel neglected, and who require a lot of medical care, who require a lot of social help. So it's very important that this category of people are addressed to right from now. Otherwise, when it comes on to us, we will not be able to address it in one go itself.
Clean water is a basic right of every citizen. To make it accessible for all, RO plants and rapid sand filter plants have been put up in 12 villages. This has seen a decrease in diarrhea cases as well as waterborne diseases. Around 35,000 people across Aragonda get 600 litres of drinking water for 100 rupees a month. The water plant, which was installed on Panchayat land, is being run and maintained by the Panchayat.
Water supply is one of the main areas that we look at when we look at health, because one of the most important diseases in childhood or in people of the vulnerable section are the diarrheal diseases and the acute infections, the waterborne diseases, so-called waterborne diseases. And thus it's very important to stress on clean, wholesome, potable water. And what we have been able to do is educate the people to use this water for their cooking purposes, for their drinking purposes, and also educate them about the benefits of rapid sand filtered water over the RO. This is what we've been able to achieve as of now.
5 साल से पानी ले रहे हैं गाँव के लिए भी अच्छा पानी पी कर आराम से हेल्थ बाग है हेल्थ अच्छा है पेट में गैस्ट्रिक प्रॉब्लम किला में दर्द सब भी अच्छा है ये पानी की वजह से पैताबरी की वजह से
Under the flagship program Detol Banega Swachh India, in March 2019, Reckitt Benckiser partnered with Apollo on the mission Arogya Rakshak Swachhta Se Swasth. This aims to drive behavior change through hand hygiene through various initiatives in schools.
This classroom is hygiene. Today we are going to learning about hygiene. Already we learned how to wash our hands and how to...
Baseline study has been introduced along with the hygiene curriculum.
See, look at here, these are the green dots.
Teachers are being trained at schools. Infrastructural changes have been made like hygiene stations. There are wall paintings in schools and a children parliament as well on hygiene. The partnership aims at making a social, economic and health impact on ground.
Half the illnesses can be cured if only they can follow this hand wash. Dettol is an addition because it kills germs. That only throws off the worms, but some can still be there. So by adding Dettol, you are killing the germs.
Hygiene is basically the core of all the business what we do. So therefore, when we say the partnership with the Apollo Healthcare, it's cared by Apollo and protected by Dettol. So we're trying to put the checklists in place. We are training various kind of medical professionals, the paramedics, so that the hospital-acquired infection rates go super low. When you work with the school kids, you can have reduction in the diarrhea cases, you can reduce the school absenteeism. As a result of that, you are overall improving the quality of life of the families.
Dettol comes back to the original thing, saying if you are cleanliness, you can avoid majority of the diseases. Previously, almost every Indian had some worms or the other. Then it became only property of the villagers. The people in the towns, their vegetables were fresh. They didn't have this problem, and the defecation thing is they improved.
Today I pledge to make
Children are agents of change.
hand hygiene.
The hygiene curriculum that focuses on wash facilities has been implemented in 14 schools of Thavanampalli, reaching out to over 2,500 students.
We take pledge every week. So whenever I see some garbage all around me, I feel like taking it into the dustbin. I feel like keeping my India clean and hygiene.
Most of the classes are happening from the textbooks and from blackboard, but it's related to totally activities. So that based on activities, most of the students like very much.
Maintenance of hygiene and cleanliness of toilets, regular monitoring of hand washing along with behavior change has seen an improvement in attendance as well.
Before hygiene session, our children are suffering with diarrhea. When hygiene session started in our school, children are how to clean, how to use the Dettol, everything, how to use the clean and neatness. So the children are very interested to anxiety to listen this hygiene session. That's why our children use Dettol every day before meal and after meal, and also in bathroom.
The Arogya Rakshak program not only works to ensure schools have adequate water and sanitation facilities, but also strengthen the infection control practices in healthcare setting with a theme, protected by Dettol, cared by Apollo.
Take a cup of solution.
Hand hygiene in hospitals play a crucial role in reducing clinic-induced infections in healthcare providers and patients. The Apollo Dettol curated curriculum, which is on the lines of the checklist manifesto by Dr. Atul Gawande, is training Apollo Healthcare Clinic staff on the same. To deliver quality healthcare, a nursing college was started in 2003, giving employment opportunity to youth from rural background and to zero down the cross-infection while delivering the healthcare services. The program focuses on hand hygiene.
In this Arogya Rakshak project, we have taken that nurses baseline survey and we have given training for them. 3 days training program is there. That time we have explained what to do, how to do, when to do, where to do, like that. These are the 4 aspects we explained to the students. After that, we have taken them to the fields. We have did that all that beneficiaries interviews, school teachers, students, one-to-one interactions with the students, everything we have covered all around this Sonampalli Mandal. All around the 14 schools we had covered.
Besides allopathy, Apollo also moved to Ayush, a preventive approach towards holistic healing.
In 2015, November, we introduced Ayush. Basically, now we are providing the services of Ayurveda, Yoga, along with the modern system of the medicine. As of now, since the inception, we have treated more than 7,000 cases in all the chronic ailments. And the beauty of this project is, here we are doing all the cases on research mode basis.
The overall vision of total healthcare is a very, very broad vision which talks about the holistic health, which actually working on the principle of not just physical well-being. It talks about a state of physical, mental, spiritual well-being and not mere absence of disease and infirmity. So the yoga centers, yoga is at the core, there is modern medicine, there is referral clinics. But beyond all that, there is something which is very special in the whole project. It talks about holistic healthcare and not just of a particular community, caste or religion. It starts with the neonates, which are in the age group of 0 to 28 days, then to the infants, then going to the under 5 kids, then to the moms, then to the geriatric care.
Another aspect of the total health is to overcome non-communicable diseases like diabetes, hypertension, cancer, and cardiovascular abnormalities, which are common in the rural areas as well. Preventive checkups is the key. The first step in the direction was conducting surveys using the World Health Organization's stepwise approach to surveillance to collect, analyze, and disseminate data.
India is going to become the diabetic capital of the world because China holds that portfolio now. Now we are rapidly increasing, they are decreasing their diabetics because of the child norm. So we will be diabetic capital of the world, but we have already become the heart capital of the world because there are many people who are dying very young with heart disease. We are cancer capital of the world because our cancer is growing at the rate of 36%, and then infectious disease capital of the world. That infection again is because of place not being clean. Why do people get dengue or H1N1? Because place is not dirty, is dirty, so flies and mosquitoes grow and they bring in this infection.
The baseline surveys organized by Total Health between December 2013 and June 2018 covered 30,600 people in 11,349 households, 69 government schools and 65 Anganwadi centers, helping classify the population into low, moderate and high risk for diabetes, hypertension and cancer. In another case, 5-year-old Devika, who was diagnosed with cerebral palsy, is being treated by Panchkarma therapy along with internal medicine and physiotherapy. The result is she is walking, her drooling of saliva has completely stopped and there has been speech improvement.
పాప నడుస్తుంది అని అనుకోలేదు. ఇక్కడికి వచ్చినాక బాగా నచ్చింది, యాక్టివిటీగా ఉంది, మనం చెప్పేదినో అర్థం చేసుకుంటా ఉంది. చాలా ఇంప్రూవ్మెంట్ వచ్చింది. 2 సిట్టింగ్స్లోనే మాకు చాలా ఇంప్రూవ్మెంట్ వచ్చింది. ఇప్పటికీ మేము ట్రీట్మెంట్ తీసుకుంటున్నాము. మాకు చాలా నమ్మకం ఇక్కడ.
As part of lifestyle modification, yoga is being introduced in the rural community of Thavanampalle Mandal along with focus on sports.
Arogyame Mahabhagyam in Telugu. So in all languages it was there that health is wealth. So what we need is, if you look after your health, automatically you will get wealth, because you will be able to work, you will be able to think, you will be able to act better. So I think it is very necessary that all aspects which are really very simple to stay healthy, what you need is to keep clean, attend to a few things which you should avoid.
The Total Health Initiative is a comprehensive program that includes happiness, which can only be achieved when the physical, mental, spiritual, financial and ecological needs of an individual are met. The holistic approach shows the way forward towards public and private partnership and how CSR can be channelized to achieve health for all.